I'd like to share with you about my gum disease program. Gum disease is one of the most destructive and health-threatening diseases we have coming from the mouth. It's the destruction of the soft tissue and the bone underneath that eventually, if it continues on, it's an infection, bacteria infection, and the bone gets destroyed with a very chronic inflammatory process. The worst thing about it, it doesn't hurt. And this infection is difficult to reach. So we have surgical approaches, but mine is a non-surgical approach. Understand, you can have gum disease that starts at around 5 millimeters of bone of pocket depth. It can go down to 6 or 8 or 10 or even 13, and you won't know it. With the gum disease in the pocket area, there's always a safety valve called the top of the gum. It just lets out the infection drainage. And so there's what usually causes pain with infections is swelling. You don't get any swelling because it drains in the mouth. I have to do a particular procedure, which is called scaling and root planing, or deep cleaning, if you want to put it, and I usually do that with anesthetic to clean the surface of the tooth roots under the gum. And then I teach people how to use a HydroFloss machine, okay? Which is, or even a water pick in some cases, that can, if you get the proper training, you can actually flush out that pocket. It goes really deep. You know, dental floss only goes about 3 millimeters, about that much. And then if you had, if the pocket is this deep, that's like 10, you're just nothing, you're not doing anything. And we use a bacterial killing agent in there, and you flush it out. And once that's done, you gotta have the scaling first. If you get that done, then the gum will start, and you flush out in between down below, then the gums will learn to stick together from the base of the pocket, deepest part, up to whatever level you're able to attain. And when that's done, you are in control. You have to be checked out to find out, make sure you're not being fooled, because like I say, you don't have the usual symptoms that you're having gum disease going on. But that's part of my job, okay, is to actually probe these things to make sure that you're in control. I'd be happy to have you come in, and I'll show you what you can do that is non-surgical, and that help you get back in control of what's going on your mouth and totally reverse the pocket depths of your gum disease.